Have you heard of twisting of the testicle or testicular torsion? Are you worried that this might happen to you? What are the symptoms of testicular torsion, and what age group does it impact? In this video, we will go through the presentation of testicular torsion in detail, and we will explain how to diagnose it accurately and manage it timely. What is testicular torsion? Testicular torsion is a urological emergency, and it happens when the testicle twists clockwise for 90 degrees or more on its longitudinal axis around the cord. This is a medical emergency and can result in a damage to the testicle if it's not managed timely. What are the predisposing factors? One of the commonly described disposing factors is the so-called bell clapper deformity. Patients with this deformity often have their testicle lying more horizontally compared to the normal person. The reason for this is to do with how the tissues around the testicles are anchored around the cord, which is the structure that contains the blood vessels. In patients with the bell clapper deformity, the testicle is more mobile and is easier to twist. Why the testicle is damaged when it twists? When the testicle twists, the cord, which is rich in blood vessels, also twists with it. This causes blockage to the blood vessels inside it, which restricts the blood flow to the testicle and causes a significant amount of pain as the testicle starts to die off. What age does it usually happen at? The peak age group where this happens is between the ages of 12 and 18. However, this condition could affect older males in their 30s and 40s and rarely in their 50s. How does it present? The patient usually presents with an acute onset of sudden severe pain. The pain is primarily testicular, but it could also radiate to the groin, abdomen, or thigh. Some patients describe feeling nauseous with the onset of pain, and some might even throw up. Some patients report previous similar episodes. Predisposed patients can have episodes of intermittent torsion, where the testicle twists for a short period of time, causing pain, and then untwists back to normal, where the pain resolves. Therefore, any patient with a history of recurrent severe testicular pain should be taken seriously, and the diagnosis of intermittent torsion should be considered in such patient. What are the findings on examination? This usually reveals a tender and swollen testicle. The testicle might be lying horizontally or positioned higher than normal in the testicle. Mild fever or erythema of scrotal skin are usually late signs. What investigations could be done to confirm the diagnosis? A urine dipstick is usually performed to rule out infection. This is typically normal in cases of testicular torsion. A Doppler ultrasound scan could be considered, however. This is only performed in equivocal cases when there is a great uncertainty about the diagnosis and when it is felt to be safe to wait for the scan first. Signs of torsion on the ultrasound scan include a poor or absent blood flow to the testicle. However, ultrasound scans are not 100% accurate, and they could miss a torsion as the blood supply to the testicle might still be present, albeit reduced, despite a torsion. However, as mentioned previously, time spent on investigations should be limited to a minimum given the critical nature of this condition. How is suspected testicular torsion managed? Emergency surgical exploration is often warranted in suspected cases of testicular torsion. The salvage rates are directly dependent on how long the testicle has been twisted. In over 80% of cases, the testicle is saved if the patient presents within 6 hours of the onset of pain. This drops to a staggering 10% if the patient presents over 12 hours of the onset of pain. How is the surgery performed? The surgical incision is usually done at the midline through the so-called median raphe, which is a thick, slightly darker colored skin at the central of the scrotum. The testicle is delivered and inspected. If the testicle is twisted, the surgeon will untwist the testicle to help untwist the cord and re-establish a blood supply to the testicle. After untwisting, the testicle is assessed for viability first by inspecting its color. If there is some doubt as to whether the testicle is viable or not, a warm saline gauze could be wrapped around the testicle and left for a few minutes. Meanwhile, the anesthetist is asked to provide the patient with a high 100% oxygen ventilation. The testicle is inspected again. After doing that, if there is still doubt, a small incision in the testicle might be performed to look for signs of active bleeding, which, if present, indicates a viable testicle. If the testicle seems to be viable, the surgeon anchors it in place using a 3-point fixation technique with non-absorbable sutures, where the testicle is anchored to the scrotal wall from 3 points, 2 on the side and 1 in the front. The other testicle is also anchored in place to prevent any future twisting. If the testicle is not twisted upon exploration, no fixation is usually performed, and the other testicle is not explored to minimize risks. If it's too late to save the testicle and it was felt to be non-viable, the surgeon might opt to sadly remove the testicle. What are the complications of testicular torsion? Misdiagnosis. Torsion could be mistaken for epididymo orchitis, which is an infection in the testicle, and in those cases, the patients are given antibiotics and discharged home. But sadly, they often come back with persistence of the symptoms and have a scan which shows a non-viable testicle after a missed torsion. In such cases, the dead testicle might form an abscess or a sinus. The body might also form anti-sperm antibodies, which could lead to infertility in the future. Therefore, surgical removal could be discussed with the patient in those cases, depending on the age and the symptoms. Very rarely, retorsion of the testicle can occur due to inadequate prophylactic fixation. Conclusions. A structured approach in managing cases of suspected torsion ensures a rapid diagnosis by a thorough examination and knowing the signs and symptoms of testicular torsion. Effective management in suspected cases by having a low threshold for surgical exploration, minimizing time wastage in diagnostics. Reducing complications in cases of testicular torsion by reaching the correct diagnosis and ensuring timely management. This is the end of the video. I hope you found it educational and informative. Please consider subscribing and sharing to help the channel grow, and thank you for watching.